I am super excited to I've been wanting to bring this guy back on for a while, but he's just been so busy trying to hook people up. It's Dylan Brockman with Brockman Health. Dylan, what's going on, man?
Nothing much. I'm glad to be back.
Man, so look, tell everybody why you've been so busy, man. Why have you been so busy?
Look, man, I mean, it's a crazy thing. People just don't realize the situation that they're in until it's put in front of them. It's kind of like putting a mirror right in front and you're like, wow, am I really that ugly? But it's not that you're ugly. It's just that they're paying too much for their health insurance, right? So, thanks to you, the team, everyone at Nifty, Thrifty, it's kind of allowed me to have this platform to help, basically everybody in the community. And, you're keeping me busy. I want to take a vacation, but I can't.
Well, so again, look, it's open enrollment time, right? And open enrollment means it's time to sign up. But again, there's a window. So explain to everyone, because people might be familiar with it, but for new practice owners, or maybe practice owners who are thinking about possibly allowing and offering health insurance for their team, but also for themselves. Talk about open enrollment. What's the process, and why is it, you got to take advantage of when it's time to do the open enrollment? Explain the whole process.
Yeah, absolutely. So, generally speaking, throughout the year, January through October, your options are pretty limited, right? There's very few companies that are allowing you to jump on their plans, and the ones that do let you jump on their plans require you to have like some special life event, like maybe you have a change in household size, maybe you moved or you lost some coverage and stuff like that. But once November 1st comes around, that opens up this big window where all of the insurance companies say, hey, here's our new plans, here's our new prices. Let's see if we can get you something better, whether it be in terms of coverage or price, or even both. November 1st to December 15th is basically that window where they say, hey, come, if you want, our gates are open. We'll accept anybody and everybody, no matter what. Your time is now to get ready for January 1st of the new year. Right.
People need to understand that, because a lot of times, if you're just twiddling your thumbs, it's going to be significant. So explain, like, if they miss open enrollment, we're not trying to scare anybody, right? Like, look, at the end of the day, health insurance is something that everyone needs, whether it's your own family, whether it's your team, whether it's a retention piece and whatnot. Everyone needs it. Everyone cares about it. Okay. So look, we're not trying to do some fear mongering. We're just literally just stating the facts. What's the advantage of signing up during open enrollment as opposed to, hey, I'll just wait later, and the next time I hear Dylan talk or post, I'll just reach out to him then? Why is it to their advantage to take care of it during open enrollment as opposed to later on in the year?
Yeah, that's actually a really good question. And honestly, it's a valid question. I wouldn't even consider it to be fear mongering per se. It's just more so the reality and the facts of understanding the opportunity you have in front of you and just taking advantage. So what that opportunity is kind of goes back to what I was saying before. All of the insurance companies are opening their doors. They're saying, hey, come walk in, look at the new prices, look at the new coverages, right? See if you can find something that's better suited for yourself, your family, your employees, whatever it may be, moving into the new year, because we're all access at this point.
Mm-hmm.
If you miss out on open enrollment, which usually ends around December 15th, usually there's some extensions and stuff like that, but right around December 15th is the cutoff. If you miss the open enrollment period, you're still going to have options. There's options that are available year round. They're just probably not going to be as comprehensive. You might have gaps in coverage. You might have, really simply put, you might end up overpaying or being undercovered, right? And I'll say that again. You're either going to be overpaying or you're going to be undercovered with the options that are available, right? They're either going to be very expensive or there's going to be holes and gaps. And each of those plans, kind of like Swiss cheese, And I'm not a big fan of Swiss cheese.
So again, just to let everyone know, we're going to mention this multiple times. Okay. We're going to mention this multiple times, but I want to let everyone know, open enrollment is from what period of time to what period of time, Dylan?
November 1st to December 15th. It's a 6-week window.
So look, I mean,
an extension, but
there might be an extension. You might get a couple of days here, but pretty much, look, guys, I'll make it very easy for you guys. Obviously, reach out to Dylan right now. You can start having a conversation, right? Even though open enrollment doesn't start till next week, you can start the conversation. Reach out to him, right? We're going to talk about, there's literally, he has a quote unquote process called the smooth like butter process. We're going to go over that really quick, but I'm just going to let you guys know this, okay? When you take the kids trick-or-treating, just understand the next day you got to take care of business. That's when open enrollment starts, right? It's the 1st through the 15th. And you've heard it right here from the expert. Not me. I'm not the expert in insurance. I asked Dylan when it's time to sign up, and he just tells me, right? But look, the expert himself said that if you don't take advantage of signing up during open enrollment, 2 things are going to happen. 2 things that we don't like, especially in the Nifty Thrifty community. And those 2 things are what, Dylan? 2 things are going to happen if you don't take advantage of open enrollment.
Yep. You're either going to be overpaying or undercovered, or maybe even both.
Oh, geez. The double whammy right there. Okay. So what I'm going to do is I'm going to share my screen here, because people are thinking right now, like, okay, well, I don't know how easy this is. Maybe you've had health insurance before. Maybe you try to do it on your own. You realize, maybe I should get someone to work with me so I can save money. Maybe you've never had that, the health insurance for yourself, or you have it for your team. Here's your chance to learn how to do it. We do it in such an easy way. I'm going to share my screen really quick, because we're going to talk about, hold on one second. We're going to talk about. By the way,
Glenn, when you talk about the process, and we'll go into further detail when you get that pulled up, but a common misconception is that when you're dealing with a health insurance broker, a lot of times, and this always confused me, and like for some reason I thought it came natural to me, or it was just common knowledge to me, but sometimes people think that they have to pay for our service. Sometimes people think that there's a fee involved in finding the right program for themselves or their families. But in all reality, if you're someone that has that misconception, my services are completely free to the consumer. I get compensated, and my agency gets compensated by the insurance companies whenever we help them find a new customer, right?
So what I'm going to do is I'm going to actually, because this is going to be a really good clip to use later on. My team's going to use this clip later on. Say that one more time, because people are thinking, if I do it by myself, in most cases, guys, I'll let you know. I know we're in the Nifty Thrifty Dentist Group, and we do we talk about a lot of do-it-yourself stuff. And in most cases, if you do something yourself, like, I don't know, just drive yourself to the ball game instead of having Uber take you, whatnot, for the most part, you can save money. But when it comes to getting insurance, right? Dylan, explain that you don't get compensated. Like, you're not taking a scrape off of us. Explain how you get compensated. So people, again, it's like, why don't you work with somebody who knows what they're doing and get you the best deal? It doesn't cost you anything, but explain to everyone. It's not coming out of my mouth. It's coming out of your mouth. So explain to everybody how the whole compensation process works for your agency.
Yeah, absolutely. So a common misconception in the insurance world is that when you work with a broker, that there's a fee or some sort of service charge involved in that process. However, the contrary to that is that when you're working with an expert in the insurance field and you're working with an insurance broker, we can help you find the best deal at the best price, basically the best bang for your buck, and it's completely free to the consumer, right? The way that we get compensated is from the insurance company. So Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, you name them, they're the ones that compensate our agency for helping them find a new customer. Right. So it's actually in your best benefit all around to have a free service from an expert, from a professional that does this every single day to basically help you find the best package in a matter of 10 minutes. Because when we do it ourselves, sometimes we end up wasting a whole lot of time, hours and hours, falling asleep with the computer on our chest late at night. Just save yourself the energy. Let somebody help you. It's a very quick and easy process, smooth like butter, like you'll probably see on the website.
Well, again, we're going to talk about the whole process there, but I want to ask you this. If someone is trying to search on their own, right, and trying to get it, and you certainly can, guys, right? Again, Dylan just laid it out to you. You work with him, you don't pay him anything. He actually gets compensated by the insurance company, and he's not motivated to send you any other way. He wants to get you the best deal. Why? Because he wants you to come back. But you said you could probably get this done in 10 minutes, but like the average person trying to search on their own, and I'm sure you've heard from people who now work with you, and they're like, I spent so much. Normally, if you try to do it by yourself, how much time are you wasting?
Gosh,
It probably take you 10 minutes to find
how
a place.
much time are you wasting? But I would say, from an entrepreneurial standpoint, it's not just the time, but it's the value of that time.
Oh, yeah.
Right. We're all, I would assume, high achieving individuals that, our time is valuable. Spending 2, 3, 4 hours, looking for a new insurance plan, trying to, compare and contrast, that's probably, thousands of dollars being taken out of your pocket because you could be out there helping another patient, with a crown or a root canal or something like that. So, save yourself the time and energy. Just leave it to the professionals, right? You wouldn't work on your own tooth.
There you go. So speaking of which, now the follow-up question is like, okay, well, you have convinced us, Mr. Brockman. Okay, we want to work with you. We want you to do the heavy lifting. We want you to do what your company is all about. And again, we're going to talk about Brockman Health too, because I want to let everyone know that yes, although Dylan looks young, okay, this is his agency. He's not working for his dad. He's not working for an uncle. He's not working for his look. He looks young. Look, you sign up, maybe when you talk to him, he'll share some beauty secrets. Who knows, right? But I'm thinking it's because he lives in Fort Lauderdale and it's nice weather out there, and happy people generally look younger. Okay, so we're going to talk about the smooth like butter process because people are thinking, all right, well, how do I work? Is it going to be super hard? 4-step process. Dylan, walk us through. Someone reaches out to you. They can look. I tagged them in this post. He loves DMs. DM him, but you don't have to. You come to the website right here. They get to the website. Walk us through the steps, Dylan.
Yeah, absolutely. So you come on the website, and any of these red buttons that say get a free quote, you can click on it. Basically, just going to ask you some really, really basic information. Your name, your phone number, your email address, a birthday, and a zip code. Really, all I need in order to get working on a quote is someone's birthday and zip code. Outside of that, once we actually book a consultation, usually within a 5-minute phone call, and that's not exaggerating or anything like that, legitimately within a 5-minute conversation, I can probably determine what avenue is going to be best based off of your budget, based off of your needs, whether you need specific therapy, specific doctor visits, specialists, someone or some facility within network, specific medications that you need. I can find all of that stuff out, put together a few different options for you to compare and contrast. And once you find the one that you like, we basically click the enroll button and we start the application process. So it's really that simple. I'm basically a dating matchmaker. I'm matching you up with an insurance plan.
So again, look, everybody has, and I want to reiterate this because sometimes dentists, we like to overthink things, right? We're thinking like, there's got to be a catch. I got to pay something. I got to do something. We just told you. He's not paid by us. He's paid by the insurance company, right? And again, Dylan, let's just put that to the side. Let's put that myth to the side that the dentists are paying something. They're paying something on the back end and whatnot. Do you get compensated differently by the different insurance companies? Like, are you motivated to send them to somewhere else as opposed to another company?
No. So basically, all insurance companies across the board compensate us the same. Really, the biggest difference is if I'm providing you with some sort of like ancillary product. And what I mean by that or a supplement product.
Mhm.
So if someone wanted to include dental and vision, then I'd be compensated a little bit more. If someone wanted to include a life insurance or disability coverage, we'd be compensated a little bit more based off of the various products that are packaged together with your plan. But overall, it's basically the same. It really just depends on what package you're putting together.
So I wanted everyone to understand that because again, it's based on step 3. If you guys read step 3, customize a program to your specific needs. It's basically what you want, right? Like Dylan, you're not gonna sneak it. Like if I don't want dental because I'm a dentist and I can take care of my wife is a dentist, so we can take like you're not gonna slide in dental in there just to get it. No, you're not gonna do that because everyone's gonna see it's open and transparent. So I wanted everyone to know that look, you work with Dylan. Literally, it is free health quotes. It's literally, if you open to his website, that's the tag right there, free health quotes there. He's here to help out. He doesn't get he doesn't care who you work with as long as it goes to step 3, which is your specific needs. Now, again, going to the specific needs can also mean like everyone's family is different and everyone has different health needs as well, right? Like let's say if you have kids that need certain things, again, can you accommodate some of those families that are unique, right? Like maybe they have a lot of kids, or maybe they have kids that have certain special needs. Can you help them find the right plan for their particular family?
Yeah, absolutely. And I mean, that's literally what step number 3 is all about. Really just discovering what's going on with your specific situation and what plan is going to be best fit for your needs. So as I had mentioned earlier, something that I would need is going to be completely different than what an expecting mother would need, right? Maternity coverage would be extremely important. For me, not so much. I'm a single guy, live out in Fort Lauderdale, and really just spend all my time working. So, that kind of stuff for me isn't too important. But, going back to the customizations, if you're someone that tells me, hey, prescription coverage is very important because of this list of medications, then I'm not going to spend our time looking at programs that have lousy prescription coverage, right? It's really, I'm not in the business of putting a square peg into a round hole, right? I want to find something that's going to be good for you, good for your family. It honestly is in my best interest to do that because I don't want to have to deal with tons of customer service phone calls, complaints. I want to sleep at night, right? I don't want to be putting people in a worse off position than when they had met me, right? And to the point that you had mentioned before, a majority of this community here is in the dental field, right? Giving someone a plan that has dental and vision may not be at paramount importance. And if we find a program that already has dental and vision included in it, the beautiful thing about working with a broker as opposed to doing it on your own is that we have the ability to customize the plans. So if you find something that is spectacular, but you're maybe paying for these extra things that you don't need, I have the ability to remove them to save the cost. So that way you're paying for exactly what you're going to need and what you're going to use.
I love it. Okay, so now I'm going to scroll down here because this is, you talk about who you serve, and we have been talking about from the scope of a dental practice owner, right? Like, hey, you have you want to get something for your family, you want to get something for your team. But again, for everyone in Nifty Thrifty, you might not have your own practice. Maybe you are, you're a contractor and where you're working at doesn't give you health coverage, right? Dylan's got your back, right? Again, you might have families, right? Where, again, it might be cost prohibitive for your employer. Dylan's got you covered there. If you're one of those temp, you guys love going on the road and being a temp, working as a temp, right? A lot of hygienists like that. They like the schedule for temp. Hey, we got you covered there. Heck, if you drive a truck, right? I just want to point that out. If you drive a truck on the side, man, you can get there too. Okay, but business owners and whatnot. So again, Dylan, just talk about, again, it not necessarily like a lot of times people are waiting like, okay, well, maybe my employer, maybe I can introduce my employer. Look, okay, if you're depending on your employer and they don't have health insurance, that's no reason to walk around without coverage. So Dylan, talk about that. I mean, for people who are self-employed, for people who work for someone, but don't get coverage, how difficult is it for them to get coverage? Is it a little bit harder for them not being practice owners?
Yeah, I mean, it's not necessarily harder. The entire process works the same no matter what. If it's not broke, don't fix it kind of thing.
Mm-hmm.
So no matter if you're someone that's self-employed, or maybe you work under someone who is self-employed, and maybe you're part of their administrative staff, or maybe you're just someone on staff as a co-owner, a co-partner,
Yeah.
whatever you want to call it, the process works the same way. And really, my niche isn't specifically driven towards dental professionals. It just turns out that dental professionals fit everything that I specialize in.
Yeah.
Right. So if we're speaking on an individual basis and you work for a practice that maybe doesn't offer benefits, I mean, there's tons of options out there. There's options out there that are income driven, where, if you make a specific amount of money, the insurance companies would actually discount your rates. You might even qualify for some government assistance, some government discounts. If you're a family that works for a smaller dental practice, and maybe the dental practice only has enough in their budget to provide coverage and benefits to the employee, but then when you start to add a spouse and dependents, it starts to get very expensive. That's something that I see a lot. Hey, maybe you can get the coverage through your employer, but then your spouse and dependents, I can have a conversation with them and find them something pretty comprehensive. That's pretty close to what you probably have offered through the job. So it doesn't matter who you are. A simple 5-10 minute conversation, I can really just narrow things down and find something that's going to be, the best fit for whatever you're looking for.
Well, you only know what you know, right? So again, look, there's a smooth like butter process here. Literally, just go. We'll have the in the comments the web Dylan's website here. But look, you only know what you know. Reach out to Dylan. Again, if you fall into any of these categories, there's a home for you here. But also, just throwing it out there. But maybe you might want to go to your practice owner and say, "Hey, I saw a Facebook live stream, and this guy might be onto something. It might be worth it for." So tell your practice, if you're working for a practice and they've been talking, and the practice owner's been talking about getting benefits for everyone, you know what? Doesn't hurt to introduce them to Dylan and see. And there's different strategies, right? For those who own a practice, and you guys are like, well, I don't know if I can afford it, right? For those who say, Dylan, I don't know if I can afford this. Mm-hmm. I'm sure you had that conversation with people, and there's different ways that you can structure it where, you're not just the practice owner is not footing the whole bill. Maybe it's shared and whatnot. I mean, is that something that you can help them with as well?
Yeah, absolutely. I mean, there's tons of ways that we can go about it. And, it, like I said, a simple conversation, might be worth just the extra knowledge, just having the awareness that there are solutions out there, and maybe it's not as bad as it seems. So if you're someone, on the other side of that coin, who says, hey, you know what, maybe I do want to offer something to my staff. Maybe I do want to be a little bit more competitive with my recruiting efforts in order to attract and retain talent. Let me offer something. It doesn't have to be that you're giving everybody in your office completely free healthcare. It doesn't even mean that you have to be offering them 50% coverage. I speak to practice owners all the time who really develop some sort of system where they offer the employees a stipend or an allowance or some sort of fixed contribution towards a health insurance plan, right? So a quick example, I spoke to a practice owner last week who had 5 employees. Only 3 wanted to participate in the health insurance. And ultimately, what the practice owner did was just find $300 per employee within their budget. So a total of $900 that they were going to stipend out to their employees. So that way they can take that $300 and go shopping for something. If they find something, a plan for themselves that is less than $300, great. They have free coverage and they're going to thank you for it. And they're probably going to consider whether or not they want to explore other opportunities because of how good the health coverage is that they have with their position. If they find something that's maybe $500, great. Maybe they come out of pocket $200 for their insurance because you're covering the other $300. You can work the numbers, find something within your budget to offer something to them. It doesn't have to be this grandiose kind of offer or benefit. A little bit does go a long way from what I've seen, at least from the outside looking in.
Well, look, and again, guys, if you have any questions when you reach out to Dylan to look at for your own family, for your own needs, right? He works with so many different practice owners out there. He knows all the different ways it's structured. Have a conversation. You only know what you know. So I have the About Us page pulled up because I want to make sure everyone understands this. Dylan, so Brockman Health this agency is owned by Dylan, right? He doesn't work for his dad. He looks young. Okay. That's why I have to say this, right? You look at this picture. He looks like, do you work for your dad? Do you work for your grandpa, your uncle, or somebody? No, this is his agency. I want to make sure that everyone understands that. But the advantage, Dylan, tell everyone the advantage. I mean, what's the advantage of actually talking and working with the person who actually owns the agency as opposed to someone who works under somebody or 2 or 3 levels from the leadership? What's the advantage with working with someone who actually owns the agency?
Yeah, great question. And, that's actually probably something I should have, addressed up front and kind of told you guys. But yeah, I am the owner of Brockman Health. It's my last name, the word health. Nobody else owns it. You can look me up. I'm the sole owner of the agency. And essentially, a little bit about my story. I'm 29 years old now. So yes, I am young, and, I hope to keep the baby face, but, I hope to look like you, Glenn. But basically 29 years old. And, it's kind of weird how I stumbled into owning the agency. It was actually by accident. And I guess sometimes people say, the best things come when you aren't looking for it. And I think this is a byproduct of that. But straight out of high school, I went and got my real estate license, and I'll save you guys the big, long story, but I got my real estate license, had a bunch of success in the real estate world down in South Florida, was doing anywhere between $8 to $10 million worth of transactions between Fort Lauderdale and Miami each year. And the problem that I faced is that, number one, I was super burnt out and I wasn't motivated to pursue the business anymore. And at the same time, I turned 24 years old. I was getting kicked off of my parents' insurance plan. I was still a dependent with my mom. She works for American Airlines. And I now had to go and find health insurance for myself. When I went and looked, everything was super, super expensive. And I understand the struggle that you guys go through as well, because at 24 years old, I was in a point where I was doing really well with the real estate career. And, I had over a 6-figure income, and all of the income-based programs just didn't make any sense. Mm-hmm. I'm like, look, I'm 24 years old. I can't pay $500 a month with a $9,000 deductible for my health insurance. I have to figure out a better way. Long story short, I did. And I figured, you know what? I'm rubbing shoulders with self-employed people all the time, inspectors, attorneys, title agents, other real estate people. Why don't I just get my insurance license and maybe help them out when they come across the same problem? Because I feel like I had figured it out. One success story led to another. And as we know, doing business by referral and just doing right by other people just it does wonders for your business. Yeah. Right. We all know that.
And then you talk to one dentist, you talk to another one, and here you are, man. Now you're dealing. Now we pulled you into the dental field because you saw that dentists, they're essentially all small business owners. They have small business, they have small teams, and a big part of the issue is that we also have families too, and we don't have health insurance coverage because we're not working for American Airlines, right? We're working for ourselves, and then the people who work for us need benefit as well. So I love that story, and I wanted to make sure everyone heard that story, because you may be looking at Dylan and saying, "Who's this young? He's working for his man. He's working for his dad, or he's working for his uncle, and can he really, really help us?" And the answer is yes. He is the owner. He not only works with all other health professionals, other small business owners, works with dentists, been a part of this community, and all it's gonna take, guys, is go to Brockman Health and fill this out. So again, not to put you on the spot, Dylan, But if they fill this out, is the chances pretty high they're going to end up talking to you, or they're going to talk to some other person on your team?
No, 100% of the inquiries that come in are coming straight to me. I have 40 people that work out of my agency. They're operating on a different kind of platform than what I'm operating on. What I'm operating on is more so just networking and connections similar to the ones that you and I have. And that's ultimately where I'm able to focus on my own personal business and kind of, lead my team by example, to show them that, hey, you can be a very busy person and still step into production and help other people, no matter how busy you are. So this is my way to kind of lead my team and show them by example. So every single person that fills out a form, books with me on Calendly, within 24 hours, they're probably going to get a text from me saying, hey, it's Dylan. I got your request. Catch me up to speed. What's going on? How can I help? And then typically from those text messages, we might schedule an appointment to chat for about 5-10 minutes. So that way I can better assist and start narrowing down some options and provide you some details. So that way you guys can make an educated decision moving forward.
I love it. So guys, it's literally that easy. And honestly, Dylan's pretty active in our group. Shoot him a DM. If you guys like sliding into DMs, hey, please slide away with Dylan here. But if you want to just put the inquiry in and let him kind of text you and give you show you the right way to go, just go to brockmanhealth.com. Or what's the number to call you? I think is this your cell phone, or is this the office number?
Yeah, that's my cell phone. That's the same number that all my family and friends have. So you guys have it too.
Just please, when you go out tonight, don't write on the bathroom wall for a good time. Call 954 unless they need health insurance. If they need health insurance,
don't give them any ideas, Glenn.
There you go. Well, Dylan, hey, thank you so much for jumping on again. Timely Facebook Live, because if you guys are just now jumping on, open enrollment, you get better deals, you get better coverage. It's from the November 1st to December 15th. December 15th.
You got
there
it.
You go. If not, then you end up paying more, and then you're gonna be sad, right? So again, just don't procrastinate. Reach out to Dylan, and let him help you out, right? Don't do it yourself, man. It's gonna take you, Dylan said 10. It takes Dylan 10 minutes. It'll take us 10 hours to do that. So don't do that. Dylan, thank you so much. Reach out to him and make sure you get that coverage you need. Dylan, thank you so much, my friend.
Awesome. Thank you, guys. Have a great day.